Good evening and welcome to Business at Prime. Well, we start here tonight. Johnson & Johnson has granted Aspen an intellectual property license to produce its vaccine under the new brand name Aspenovax. The deal makes the biggest medicine producer on the continent, Aspen, the first and only manufacturer of a COVID-19 vaccine on the continent. We are joined now by Stavros Nicolaou, Aspen's Senior Executive for Strategic Trade, for more on this deal. Aspen, Stavros currently has an agreement with Johnson & Johnson to actually produce the J&J vaccine. Tell us how this deal is actually different from that previous engagement.
Firstly, thanks very much for having me. Today's announcement, which is a significant evolution from the contract manufacturing arrangement that is presently in place, represents a pivotal moment for the African continent. The manufacturing agreement that we presently have has evolved into a licensing agreement. This means that Aspen will now receive the license for the intellectual property of the Johnson & Johnson COVID vaccine, which is, of course, the preferred vaccine on the African continent. What does that actually mean? It means that Africa now has its own vaccine. In simple terms, it means that Aspen will be producing this vaccine under its own brand name. It's called Aspenovax, is the brand name that we've assigned to it. And it will mean that Aspen will have the right to allocate and distribute this vaccine to the continent. It is no longer no longer just a contract manufacturer. It now determines the fate and where those vaccines go.
Are you at liberty to share with us some of the financial arrangements? This is a massive deal, and some would say that you may have to actually pay something towards to J&J. And will this deal make the Aspenovax vaccine cheaper than the J&J vaccine that we have been importing?
So to be honest with you, we are not in a position as yet to unpack some of those details, simply because we're at the start of the process. Our immediate focus, of course, is to acquire the regulatory approvals, some of the accreditations that are required. We intend expanding our capacity. That requires accreditation from the various regulators. And of course, we need to focus on setting up the supply chains. So that's our immediate focus as we move towards a definitive agreement and are more advanced in these initial phases. I guess we will get a better picture of what the type of volumes are, what the price is. None of that can be determined right now, other than to say that the continent has a gross inequality of vaccines. Less than 3% of the global COVID vaccines have been supplied to Africa, so there's a gross inequality and uneven distribution. And Africa needs to vaccinate around 800 million citizens. So that is the scope of the volume that exists out there, but very premature to delve into any of the economics at this point in time.
Stavros, let's talk about something that's very important. You have been talking with J&J to try and make this deal happen. Intellectual property has been something that is quite topical, and many countries around the world have actually been trying to do exactly what you have actually done. How many vaccines are you targeting? I know that you, in the Gqeberha plant in the Eastern Cape, you can produce a certain number of vaccines. Since you are targeting the rest of Africa continent, how many vaccines can you produce on a daily or a weekly or a monthly basis?
Our present capacity, which is in the public domain, of course, is that we can produce up to 300 million annualized doses. So that's 300 million doses of the J&J COVID vaccine on an annual basis. We have also, in recent times, publicly stated that we have an intention of expanding that to 450 million doses in Q1 next year. And we also have ambition to expand beyond that. We've also mentioned a number of scaling up capacity to 700 million doses over the next 18 to 24 month period. So those are certainly the capacity expansions that we are looking at. It ties in quite neatly with some of the numbers I indicated earlier. So we do certainly have ambition of being a significant contributor to COVID vaccines on the continent, but also in time to diversify into other vaccine solutions for the continent. I think it is really important that we mention that at present, the continent imports 99% of its vaccine requirements. So for a continent that's got the most disproportionate disease burden, it's counterintuitive to be importing 99%. So this development today, this significant milestone announcement between Johnson & Johnson and Aspen is a really good starting point to dent some of that 99% importation that the continent is afflicted with, and to start not only improving access to vaccines on the continent, but also equalizing the distribution of vaccines to the continent.
Yes, indeed, this is a significant deal. One challenge that South Africa and the rest of the African continent has had, Stavros, among some countries around the world, is the challenge of convincing some in our population who are actually not wanting to vaccinate. You have a very big role to play when it comes to the message that you're going to send out. How are you going to do that, to convince people who may be reluctant, who are reluctant actually to take the vaccine? How are you going to convince them to do so?
I think one needs to look at the facts here. So vaccines have been proven to be highly efficacious, and they've proven to be extremely safe. Over 8 billion COVID vaccine doses have been administered around the world, and the results have certainly been impressive in that these vaccines have significantly reduced both death and severe disease, or severe morbidity as we call it. So the evidence is overwhelming. So in the first instance, by vaccinating, you are preventing death and severe disease. Secondly, when we get these surges and spiraling numbers, this overburdens our healthcare system. And when the healthcare system gets overburdened, you naturally have this knock-on effect of lockdowns, which significantly damages the economy. So put very succinctly, vaccines save lives and livelihoods. There can be no better or more compelling a reason to want to go and get vaccinated, because you want to save lives, you want to stay alive, you and your family members, and you also want to stay. You want to save livelihoods. We cannot continue experiencing these economic shocks every time we have to lock down. When does the government lock down? Primarily when the health services are overwhelmed. Vaccines keep you out of these health services. So there's no more compelling reason why you'd want to go out there and get vaccinated.
So Stavros, I wouldn't be mistaken if I were to say that you yourself, as a businessman, as a member of business organizations, you are part of the group that says that that is backing President Cyril Ramaphosa in his feasibility study to see the efficacy of actually making vaccines mandatory in South Africa.
In fact, we are more than backing that. And in fact, we're saying that we don't necessarily have the luxury of time here either. Last week, Aspen hosted President Kenyatta, the Kenyan president. Now, Kenya has gone with a restricted access policy from the 21st of December. What that means is from the 21st of December, all Kenyans will have to be vaccinated and prove that they've been vaccinated in order to access public facilities and amenities. So you won't be able to get onto a train, a bus, or a plane by way of example, in Kenya after the 21st of December, unless you're vaccinated. So the world is going in that direction. I am concerned that the longer we delay this decision in South Africa, the more likely we are to have more surges, more transmission, and regrettably, more lockdowns, which are really causing immense hardship, economic hardship to many, many families in our country.
Stavros Nicolaou, Aspen Pharmacare Group's Senior Executive for Strategic Trade and Development, thank you very much for your time. As they're talking to us about this significant move to actually make sure that we have access to vaccines on the continent.